to help. They're getting ready to start. Well, actually, they started the new line. It's about to be advertised. So I imagine that the message boxes are going to start filling up shortly. So the new number is 240-777-1, no, sorry, 777-2982. That's going to get you to the new vaccine registration or pre-registration line. Really what they're going to be doing is giving out information just like you all can when you take off the messages. There's a lot of very angry people out there that they all want their vaccines and they're panicked. So I'll try to give you as much as we have. Let me just share. Hold on. Let's see what I can share. Where's my Montgomery County website? I just had it up. Give me 1 second. Well, it's not coming up. Maybe I can do it this way. Nope, that's not going to do it. Give me a second. I am somewhat challenged, so maybe I'll do it from here. So if people go to, let me see if I can share it now. Yes. Okay. Let me know if you can see this. It says COVID-19 updates.
Yes.
Yes.
Okay.
Yeah.
So yeah, so when you're calling people back, I would always have this page up, not necessarily this one. I'll tell you how to get to the next one. Or also say to people, you know, if you need information, please go to www.montgomerycountymd.gov and click on it. And then I usually give them instructions like go to the purple ribbon, and then it says COVID-19 updates, and then go to vaccine and priority group information. This is Montgomery County's vaccination page. It has all of our information on it. So it'll say here pre-register. I wouldn't do that. I go down. This is the number, the new registration number that's about to go out. They have frequently asked questions. So you can just redirect callers to this page to get most of their information. You know, some of them are can't do the computer or whatever, so we kind of walk them through it. It says here, all vaccinations are by appointment only, no walk-ups. They're going to be sent an email or a text message when it's time for scheduling their appointment and a list of the clinic dates and times that they can go to. I would go down to here because this is very easy for people to understand. We are currently in anything that's green. That's who we're vaccinating. So I always say, yep, go to the website, and if you fit into green, we're vaccinating you right now. If you fit into yellow, that means you can pre-register, but we're not here yet. It'll turn green when we go to the next phase. We just started 75s and older. There are 73,000 of them. And right now we're only getting 7,000 vaccines a week. So it will be difficult. So say somebody calls and says, so you're going to get a lot of these, the people that are 75 and older, and they're just like, I just need to pre-register. So you can say, have you pre-registered before? Because these people are staying up all night long and they are registering anywhere they see COVID vaccine. So they don't even know where they've registered. They've just registered everywhere hoping that somebody's going to call them. So you can pre-register them again, but if they were already registered, they're in the system. So you would click on pre-register. So it says you must live or work in Montgomery County to receive vaccine doses at our clinics. You must pre-register to make an appointment. Pre-register by calling this number. I don't know why they're saying that because you can do that from there. Anyway, you will not receive an appointment right away after pre-registering. You will receive regular updates from us about setting up appointments. Your appointment is just for you. The problem that we're having right now, and let me know if you guys get confused, is so you pre-register and then you go into this big database. And then however they choose to prioritize that database, they send out X amount of emails with a link to be able to register for an appointment. What people are doing is they're taking that link and sending it to 20 of their best friends who send the link to 20 of their best friends who send it to all these other people. And so then we're going in and finding out that 800 of the 1,200 people that are signed up to get the vaccine aren't eligible. and then they have to delete them all, and then we have to get in the people that are eligible. So it's a huge problem. So you need to really stress, when you get that link, it is just for you. It is not for you to share with your other family members or anybody else. So right now you can pre-register. Well, you can pre-register for any of those, but you can pre-register for priority groups 1, B, and C. So
Yeah, there's
C,
a question in the chat.
sure.
If people don't know, as you've said, that they have, if they had registered with this particular form or not, is there a way to check and confirm and then get back to people?
We don't have that, so you can just put it in. They'll just delete it if they've already done it.
So it's better to just pre-register
Yeah.
again if somebody's
Yeah.
not sure.
Yeah,
Okay.
I would just say, yep, you should just, why don't we be safe? That's what we say. Why don't we just be safe and let me help you pre-register again, and then you'll know. Because in the
Excellent.
beginning of the pre-registrations, they didn't send a confirmation email at the end. It just said success. And then, and now you should get a pre-registration email saying you have pre-registered. And then I don't know what the email says. It says something like you pre-registered now, now you have to wait.
It says you pre-register, but this does not mean you have an appointment.
Yeah, there you go. Thank you.
Yep.
Yep. So, and that's the other thing that especially the 75s and older don't understand, is that just because they pre-registered, that doesn't mean now they can jump and then register for an appointment. That just means you pre-registered. When it's your time, you will get an email. If they don't have an email, that's okay, because I get a list of all the people that don't have emails, and then we call them and make their appointment when it's their turn. We're getting lots of calls saying, I registered 3 weeks ago. I haven't heard from anybody. We just opened up to 75s this week. So, and there's 73,000 of them. So it is, it's going to take time. They're going to have to be patient, and nobody wants to be patient. And I get it. If we could, put a needle and vaccinate every single person in Montgomery County, that's what we want to do. But we don't have the vaccine to do that. So we're trying to start with our most vulnerable population. So is your role is to actually pre-register if that's what they're asking for. If you have a message that says, I just took off, I didn't even know the line was active, so I'm still taking off messages from last night. But a lot of them are saying, I'm 88 years old, I'm trying to pre-register. It's really easy to pre-register. I'll show you. But so yes, if that's what they need. If they need to register, then you're going to have to. I guess we'll see the sheet that you guys are taking messages on, and that'll have to be from somebody that'll have to make sure that they are eligible to register. We're finding now where people are calling and saying, I want to register for the vaccine. I got a link and I'm 65. Well, I know you got that link from somebody else, because we're not sending it to people that are 65. So then we have to go through that whole thing.
Quick question.
Sure.
I understand that Adventist hospitals and Medivac, that company of hospitals are accepting people who are 75 and older, MedStar. And if you go to Adventist Health, you can register with them, and you can put the locations you would be interested. Are those associated with DHHS?
No,
or
that's
different?
Maryland. That's Maryland. So I'll show you that in a minute.
Okay.
So let's go through DHHS. And then there's other sites. There's Giant. There is, as you said, Adventist Healthcare. I think there was a big snafu there. They sent all these appointments out to people at Adventist in White Oak today. And then when they got there, there was no vaccine. So they had to send everybody away. So that we're also getting those calls. People think it's county run. It's not, but we just listen to them and say, I'm really sorry that happened. And then we follow it up with, have you pre-registered on the Montgomery County website?
Can I interrupt for 1 second? I just want to give some context, because I think some people need a little bit of background. So the way things are set up right now is that the state is the distributor of all vaccines to all providers. Montgomery County government has not been the designated distributor to local vaccination sites. So things are a little bit more diffuse in that respect. Montgomery County government is but one recipient of vaccination doses, and we're doing the best that we can in deploying those based on state priorities. However, there other providers, such as hospitals, other healthcare providers and pharmacies, and Giant as a pilot. And that is what Deb is going to cover at the second part of the training. But when people call you, or actually when you call people back, it's really important to stress the fact that the state is using multiple avenues for vaccination distribution, and Montgomery County doesn't have oversight over those particular providers, even if they are within Montgomery County territory. So that once you've gone through the pre-registration information with people and had given them the information on how they should expect a callback, they can then receive information from you about additional places they can sign up for vaccinations. And we will cover that after we're done covering the pre-registration information. Does that make sense? I'm guessing so.
Yes.
Okay.
Aziz, I have a question.
Yes.
Can we get the list of those organizations that?
Yes.
Yeah, we need
That's
that.
that's going to be part of this training. You'll see that Deb has prepared something for us.
Okay, excellent. Thank you.
Okay. Yep. Sorry, Deb. Go ahead.
That's okay. No, we needed to do that. So, that's a huge part of it, is that people just think that that everybody is getting all of this vaccine, and we are not. The governor gives out X amount of vaccines for each county, and Montgomery County, usually we don't even find out until, like, I don't know, 2 days before that week starts. So it's really hard to plan the clinics because we don't know how many people we can take at each clinic. So let me see. Can you still see my screen?
Yep.
Okay, so this is a pre-registration form. And so it's really easy. Does this person who will be receiving the vaccine live in Montgomery County? Yes. And then please select the occupation of the person, because what's happening right now is the teachers have been sending links around. So I don't know, it'll let me pre-register, but because I think they're in 1B tier 2, but it won't let them get a link right now. So let's just say, for the sake of argument, I'm gonna say, well, maybe we can do none of the above, because a lot of the seniors are retired, right? So they're not in any of these anymore. Are you the person that will be receiving the vaccine? Yes. And then your name. So let's just say. And then the birth of the person. They're going to say I don't qualify. I wonder what year you are if you're 75. In any event.
Put in 1945 or 1946.
We'll try that. Does the person who will be receiving the vaccine have one or more of the following high-risk medically diagnosed? So if you have anything like this, you can put it in. It's not our job to determine whether they qualify. Like
I'm sorry to interrupt. Are you able to make the screen a little bigger?
It's as big as mine will be.
Oh, okay.
Sorry.
And if I could ask a quick question, do you mind going back? I think it's question 5 or 3. I'm sorry, 3. If they say no, I'm not the person, that's okay.
Well, I mean, then are they trying to pre-register for somebody else? So at the end, they'll have to put who they are trying to register, right?
Okay. But
So like if a husband calls to do his wife, or a daughter calls to do her parents, then she would be like no, but then see what happens. Who are you?
Gotcha. Thank you very much.
I have a question. This is Pat. How sure we are that they're giving us it is the person's date of birth? Are we just taking what they say?
We have to believe them, but when they get to the site, they have to show their ID. So if they lie, they'll be turned away. Yeah.
All right, gotcha.
Yeah. So just say, I need your date of birth, and at the end of it, you can say, okay, we'll go over the little script at the end. But
okay.
So this is, do you have any of these? If you say yes, then they're just going to leave it there. So then it's going to. Yeah.
Sorry to interrupt. I think because the font is so small, what we're going to do, everybody, is we will provide you with the entire script. You won't have to log online and actually go through the registration yourself. So you will know what questions would be coming up.
Okay.
Okay, so I said no here, but if you said yes, I mean, it just says yes. We're not determining, if they might say, "Oh, you know what, I have, cystic fibrosis. Am I going to be able to get the shot?" You just answer, "You know what, you need to call your healthcare provider and discuss it with them. We'll just continue to sign you up, but that's not for us to decide. That's for their healthcare provider to decide." Does this person who will be receiving the vaccine live in congregate setting? That's such as a nursing home or assistant living or, something where there's a lot of people in one setting. So I'm going to say no. I wonder what happens if you say yes. Nothing. Okay. Is the person experiencing homelessness? Does the person who will be receiving the vaccine have any intellectual or developmental disabilities and are not living in assistant living group homes? The state and the county are sending vaccines to the nursing homes and to the assisted living groups. So I think that is, who was it, Walgreens or something? They were going into all of those group homes and the nursing homes and giving the vaccines to them. That was in tier 1A.
Can I jump in there?
Yep.
Was this approved? That's a question that is under the ADA actually not allowed to be asked if someone has a disability.
Well, I can just go through what is here. I mean, they do because the ones with disabilities are prioritized higher.
Okay, thank you.
Will the person be receiving the vaccine require special assistance to travel to a vaccine clinic? This is a big one because there are some people that say, "I'm unable to leave my residence." So they're working on a plan now, whether we have groups that go house to house and give the vaccine, whether they do, I don't know, go to some of the high populated elderly buildings, the high rises and stuff that a lot of the older people live in, and do a vaccine clinic there. That's what they're working on. So if they do, then you would just say, "I do not have transportation." I'm sure they're working on a process to transport them to a clinic if they need to. Yes, I need assistance. I'm unable to leave my residence. Or no, I don't need any assistance. I can come to a clinic. I'm going to do that one. Then we go next. And then who's going to be the primary contact? So if you're doing it for, say I was doing it for my parents, then I would put my name in here because I want them to call me so that I can, I want the email to come to me. I want everything to come with me because I'm the one that's doing all of this for them. So you're just going to put in whatever. Street address of the person who will receive the vaccine. All right. So I'm just going to put the one that's there. So that's if they had an apartment number, you would go down further. The city, so let's just say Rockville. The zip code. Does a primary contact have an email address? If you say no, then it'll drop down to what is the contact number that you want? Because that will be anybody that doesn't have an email obviously can't get the email that says your time is up, you get to go get the vaccine, but they're going to get a phone call that has it. So let's just say that I'm putting in this number. Can your preferred contact number receive text messages? Because if it can, then they'll text message you and say, "Hey, it's your turn. You can get the vaccine." If you say yes, that's fine. If you say no, that's fine. They're going to leave it here, and then when we get this spreadsheet in the mornings, it'll be you need to call this person because we couldn't even text message them. Then their preferred language. So, and then that comes up, and then we just divide the list up and get people that can speak the different languages. And then the age of the person. So now it should be, right, 75 or whatever it is. Let's just say it's 76. Gender of the person. The race of the person receiving it. So you want to, I guess they're doing it for statistical purposes. And then ethnicity. So if they don't want to give that, they don't have to, or they can say, "I am not Hispanic or Latino," or "I'm Hispanic or Latino."
I will say also, I just want to jump in. I think this is not just for statistics. There is grave concerns around equity. And so we're trying to make sure that access to the vaccine is available to everybody and anybody in the county. And we've seen that not enough communities of color have been represented in the registration pool right now, which is a part of what the effort we're putting forward right now in providing phone access as well.
Thank you. So then a disclaimer, this information you share will be used to notify you when an appointment is available and for purposes allowed by the Health Insurance Portability and Accountability Act, such as healthcare operations and statistical purposes. Your protected personally identifying information about your request for a vaccine will be considered confidential. Non-identifiable aggregate information may be used for other statistical and public safe purposes. So then you submit it. And that's what they get. Thanks. We've received your vaccine pre-registration. You must live or work in Montgomery County to receive the vaccine at our clinics. And then it says the next steps. When we have doses available, we will contact you to make a vaccine appointment. We will send you an email with a link for scheduling your appointment and a list of available clinic dates and times. If you gave us a phone number that can receive text messages, we will also send you a text message. And then we're opening a call center this week. So this is where you all come in. And that phone number is, well, I guess they'll update it because the phone number is available now. And then you can also go to the website, which we were already at. So if I hit that, it takes us right back to where we were. And that's it for pre-registering. Then you do need to remind people, okay, this just means that I always say it in a way that's like, all of this information is collected and goes into a huge database, and then they prioritize it from there. I don't know how they prioritize it. They're not going from oldest to youngest, but they're going in different zip codes and, trying to get a huge demographic of people that's equitable for all. And then they send the emails to them and say, and then stress, when you get that email, please do not share it with anyone else, because when they do, it just takes a vaccine that could have been used for somebody else, and it's, used for whoever got the link the other way. Does that make sense? Anybody have any questions? Okay, so most of the calls that I pulled off were about pre-registration and about making an appointment. Like I said, they believe that once they've made this pre-registration, like they should get an appointment tomorrow, but that's not going to happen. It could be weeks before they get one. So you just say, sit tight, you are pre-registered. They should get an email that also says you have pre-registered, and when it's their turn, they will get an email to or a phone call to register for the vaccine.
I have a question.
Go ahead.
So county providing transportation to those who are unable to go by themselves?
Not yet, but they're working on a plan. So that's why we're gathering the data, because we haven't had that up until now with the 75s. Like all the people that were healthcare workers could get to the places on their own. That's what we've been doing for the last month, is vaccinating the healthcare workers. Remember one of the whole points of vaccinating all the healthcare workers first is, as soon as we can get more vaccines, we're hoping that, the healthcare providers can do it in their own offices, or, they're doing it at the pharmacies, or, anybody. There'll be a whole bunch of places that can do the vaccine, not just certain places. And then people will be able to go what's closest to them and make an appointment.
So if like we ask that question and customer ask us whether we are going to provide the transportation, what will be our answer? Pazit, are we going to get a script about it?
Yes. Yeah. So I think this is a situation of building the bike while riding it. Currently, there are some transportation providers in place that had been serving the older population, regardless of vaccination needs, and we are still able to tap into them. So the answer you can give is, once you get the registration link, we will then figure out your transportation needs and say that there are lots of solutions in place and that we will not leave people hanging. But at the moment, if they're only pre-registering, then there's no need to figure out a particular solution. As you can imagine, it depends on where the person lives and what their unique transportation needs are, so that we don't have to give prefabricated solutions. We will tailor it to a particular situation.
Okay, thank you, Pazit.
Yep.
And you'll find out that a lot of people, there's like, I can get there. They are so panicked that they, I have a family member that'll come and pick me up and take me. Like, as soon as you give me an appointment, I will figure out a way to get there. So that's that. So you can also, is there any more? So there's other things you can just familiarize yourself with this page, but you know, you might get somebody, since it's a vaccination line, that wants to know how they can help vaccinate. So you would just click on here, and this is where they would go, and they can make an account with the Maryland Response Medical Reserve Corps, fill it out and make an account, and then their name will go in a database when we start to need more people to vaccinate. So the main page has a lot of information on it. This community service, this confused a lot of people. This was trying to just get an idea if people would take the vaccine, and if they wouldn't, why not? So they don't have to do this, but it was like, do you plan to take it? If not, why? You know, like, you don't trust the government, you have concerns, you know, I'm not sure the vaccine will be. So they were just trying to get an idea of what people were thinking. This is before the vaccine started coming out. They can also, this is a good thing, they can sign up here for emails and texts. So as we move to each phase, they put their email in here, or their mobile number if they have one, and you click that. I'm already in it, but say we went here. And then I'm going to get a confirmation email that says, or a confirmation text that said I've signed up for it. And so every time, I just got one, it just says, welcome, you have made the following changes, because I was already in. It says, welcome, you've made the following changes to your Montgomery County subscriber preferences. So anytime we go to a next phase, or there's an update in what we're doing, they'll get an email or a text that says we've moved. Like when we're ready to go to tier 2, it'll say we are now moving to tier 2.
I have a quick question. For example, what you're saying is that the county receives a certain amount of vaccines. Are this pool of vaccines going to, like, Giant? Are they distributed to Giant, or does Giant get their vaccines somewhere else? Because when I talked to the pharmacist 2 weeks ago or 3 weeks ago, she and I know each other fairly well. She said, we are going to, I cannot even give you the applications line yet, because we're only going to be getting 1 box of Moderna.
Yeah, well, that comes from the state. So the
Okay.
state's doing the Giants. The only ones Montgomery County is doing is these sites that the county is doing. Maryland has partnered with Giant and some of these other places, and the hospitals get theirs from Maryland. I think some of the doses for Giant stuff come out of the Montgomery County pool, but Giant only gets 50 doses a week. So those appointments are gone in a second. You know, hopefully that will increase, but I don't know when.
I have 2 questions. The first one is on this page. Instead of utilizing the one at top, we're going to the green tier for registration. Is that correct?
Yeah, you can use this one.
Okay.
I just like to use the other one better because, well, this one, pre-register, what does it say? So this is pre-registration. So you can do it that way too, or healthcare providers. I just like the other one because it's easier for me to get them to, if they get doing it at the same time as I am, to get them to understand the different colors. Like if they wanted to know who is, so right now we're doing 75s, right? 75 and above. And if they want to know, okay, well, who's next? These are the people that are in tier 2. So when we move from tier 1 to tier 2, here are the people that will be getting the emails to register for the vaccine.
Gotcha. And the other
That's
question.
where the teachers come, and that's where the child care workers come.
Okay, great.
And then manufacturing's there. The 65s and up are here. They're really mad. They want to be way up here. You know, and then we have these, and then we have, so these are people. So say somebody has, I don't know, 16, well, we are doing Moderna, which you have to be 18 for. I think it's 18. Hold on, let me ask somebody. I'm all confused now.
While Deb does that, I want to focus on the fact that very much in the same way that we have provided language access line through the language line with the rental assistance and food, you would be using the same type of language line. We will have a spreadsheet where calls would be recorded, and you would be able to access the people's information and callback number and their preferred language. I'm going to actually do that later on. I'll show you on a share screen where you can find lists of people to call back, but it's very similar to the rental assistance process because this training will be available to other partners in the community, and we're not going to go into that right now.
Okay, I'm back. Sorry. So it's Moderna. So that's what Montgomery County is. Well, that's what we are giving out as Moderna right now. We are not giving out Pfizer. There are other places like the hospitals are doing Pfizer. PG County was doing Pfizer. Eventually we may get both. We'll give whatever we get, but right now we're getting Moderna. If you get 1 dose of Moderna, your second dose must be the same. So what the problem has been, just to confuse everybody, is when PG County opened up, they just had a sign-up sheet, and a ton of Montgomery County, I'm sure it's been all over the news, Montgomery County people signed up and got their first dose in PG County. Now they're all due for their second doses, and they got Pfizer. So where are you going to get it? Because we're not giving Pfizer. And PG County has now said, you can't come to us if you're in Montgomery County. So the counties have talked, and Prince George's County has agreed to give those people that they vaccinated the first time their second dose. But nobody new can go from Montgomery County to PG County because each county is allotted a certain amount of vaccines and it should be used for their citizens in their county.
And then finally, will we be going to this page or will we have our own link, Pazit, in terms of going directly to the registration, or is this where we're always going to go to fill it out?
I would just use this website. I mean, it's pretty easy. We will have a list of links for you to use on the work group, so you would have access to this pre-registration as well as other links you might want to share with people, and Deb will review that.
Thank you.
Elsa has a question. I think you'd covered that before. Is the pre-registration just for Montgomery County residents?
Yes.
So you said something about people working in the county. That's not the case then?
No, they need to get their vaccine in the county in which they live.
Okay, thank you.
So as we go down, like we're going to start getting questions eventually about tier 2. Tier 2, so here's tier 1, right? 65 and up. Tier 2, they're going a little out of order because this is going to be people that are 16. Well, it's going to be 18 because Moderna is only 18 and up. Is going to be 18 to 64 years with medical conditions. And this is what their medical conditions are. So they're going to jump the line. So people that, would be normally in the next group, under 64 or under 65, they're going to get to go in here if they have one of these high-risk medical conditions. And I don't know if they're going to have to show proof of it with a healthcare note or whatever. We haven't gotten to that point yet. So if you just go through these and just click on them and make yourself familiar with her, it's pretty self-sufficient. And the general public's not till priority group 3, so I don't know. They'll probably be in the fall.
A
Unless we get
question also, they're saying that they are extending the 3-week into 6-week. Some people are asking that question. Now, if you are extending, let's say the 3-week to 6-week, then you have to register again for the second dose?
I missed your question. As
Okay.
far as we're doing the second dose in 3 weeks.
You're doing it in
28 days.
So
No, it's
let's
28
say that-
28
let's say
days.
that person goes to get the vaccine. They get the vaccine. Do they have to register again for the second vaccine?
No, they'll get an email. We have a database that has when they
Okay,
had it, when they got it
okay.
through us, and they'll get an email. It's only a couple days before their second one's due. They'll get a email saying it's time for your second dose. I only got one clinic, so they were like, you can go to this clinic on this day at this time. And I said, okay. So I went. So it's for Moderna, it's 28 days from your first vaccine.
Thank you.
Deb, there's a comment by Lisa, which is, I think, where I got my confusion. I think the text that you have read mentions the two conditions, live or work in the county. So you might want to go back to the people who run the website, or maybe I can do that and just delete the or work there. So you must live in Montgomery County to receive the vaccine.
Right. Well, I mean, they make concessions all the time. So we usually say, you know what? I usually say get it wherever you can first. But they have been doing some people that live out of county, but they're trying to force people back to their own counties because their counties get vaccine based on their population.
And Yolanda is asking a question. So we're going to receive calls on our phone via Teams from callers? No. We're going to work very much in the same way we've done so far with the food access and rental. We will have a list of people on a spreadsheet, and I will show you where it is later on, and call back. So we will be retrieving voicemails from the public health phone line and then get back to people that haven't gotten a live person.
This is
that going to be?
I'm sorry. Go
That's
right
all right.
ahead.
I was just going to ask, Bazita, is that going to be like a shared thing where I can see what you guys are doing as well? Because there
Yes,
might
yes,
be people up there that we want to call instead of you all, like people that want to register. We'll just take those.
Yeah, we'll figure this out, you and I, but I
Okay.
think, yes, you'll have access to everything that we do.
Okay, perfect.
And Karen, you had a question.
Yeah, quick question. Governor Hogan said he was going to be partnering or attempting to partner with Johns Hopkins. Does that mean that the locations for the clinics are going to be Johns Hopkins, or will there be more of a variety of locations?
I know that he's partnered because they're talking about vaccinating the teachers. So I don't know where he's doing that. I don't know where those locations are going to be, whether they're going to be, you know, in big venues or if it's just going to be coming to a Johns Hopkins. I don't have that information.
So what we're going to do is, because you would get these questions, we will have a channel for updates on all the recent changes put forth by the state or county, so that when you go back to people, you will have the most updated information to let them to get back to them.
Okay.
So also on this page, find other vaccine locations. So this is on maryland.gov. So that link just took you straight to it, right? This tells you what phase Maryland's in. Maryland's in 1C. Maryland is quite different. This is where all the confusion comes. Governor Hogan keeps saying we have now moved to 1C. Montgomery County is in 1B. We are letting people register in 1C, but we're not giving doses to 1C yet. So, so it says here, find a vaccination site. So say I put in my zip code. So you just put in the person's zip code, and then I want to find a vaccination site. And this is going to give me a 15-mile radius. These are all the other sites people can go to. So here's Giant, and here's a number they can call. Adventist at Shady Grove. Schedule an appointment. Tuesdays, Thursdays, Saturdays, 8 to 8. Montgomery County Health Department, that's us. That'll take you right to this page you were just in. Johns Hopkins in Germantown. Giant Food Bethesda. MedStar Montgomery Medical Center. Holy Cross Hospital. Giant Food Silver Spring. So that's what was near me. I'm sure if you did other zip codes, there would be other stuff.
Can you go back and I missed that part of how you jumped to that red COVID Maryland thing.
Okay, so I started here. This is the page we're on, right?
Yeah.
This is the main page that you'll need right here. Find other vaccine locations.
Okay.
Or you could just go to maryland.gov. But if you click this link, it's going to take you right to maryland.gov, right? So then you're just going to say find a vaccination site. And then you're going to put in whatever your zip code is. So let's do a different one. It's probably going to be the same if I did 2850. And did you just see that? Beginning February 1st, Safeway and Rite Aid will provide vaccinations. So this is a good one to just, you know, keep refreshing to see when they change things. So this one is, so say I wanted to go here. It's going to take me to their website, vaccine, and then it'll tell you appointments required. So all of these are closed. They have no vaccines, but you can do alert me when you do. So this is what people are doing when they're saying, I did everything. They're going to all of these websites and scheduling an appointment, and they're trying to get an appointment wherever they can. And then when they call you, they have no idea where it was, or they get really mad because they say, I just got a call for, that I get to go get my vaccine, and I told them I needed transportation. So we don't know where they registered because we weren't doing it. So then we kind of had to tease. So where did you register? They registered at Holy Cross. They registered at Shady Grove. They registered here. And then you say, well, what does it say on it? Because I don't know where you registered, so I don't know how to help you. So you kind of have to tease out where they registered and where they got the email from, and how to help them from there. Because technically it's up to the site will ask if you have transportation issues, and that's their job to provide the transportation to their site. So like I said, these are Maryland sites. These are not not funded, but I don't know what the word is, run by Montgomery County.
Thank you.
And they're all doing different vaccines. Some people are like, I only want to do Moderna. Okay, well, you'll have to check with them. I don't know what they're doing. Some people are doing Pfizer, some people are doing Moderna. We're having trouble now where, people have gone to Florida to get their first vaccine, and it was Pfizer, and now they're here in Montgomery County where they live. We're not giving Pfizer. So we're kind of like, you have to call around to all the hospitals and see if they can fit you in, because we don't have access to Pfizer. So people are panicked, rightly so, but they're making things very complicated because they're getting vaccines that we don't have access to. These, I know somebody was trying it here. We were seeing what they were going to be like. I don't know what that is. And they were in the queue. It says you are number 4,516 in the queue. I mean, you would be on, and that's what people do. They stay on for hours and hours and hours. And I don't know if you end up on a list or if, they just say, so this is, they're telling you what phase you're in, 1C. So if you said get vaccinated, it's going to take you right back here. So a lot of them just take you back where you started from. It's complicated, and it's hard for the older people to navigate because it's so.
I will say that we're trying to build capacities for volunteers to help with the actual appointment registration. So there will be some additional training to individuals on these resources. At some point when everything is set up, you would have information on letting people know where and how to call for actual help with the, the lengthy and frustrating process of finding an appointment.
So, I mean, we just, all the time, if we, in our downtime, we play around on these websites and try to see what they have. But each website has a bunch of information about the vaccine. There are no appointments places. So that's the problem, is that people are just frustrated because it doesn't matter if they go in here. This is us. If they went in here, it would say schedule an appointment, and then you would try to, and they would be like, we're closed. The other day, I think it was Holy Cross in, I don't know if it's going to show me now. It was Holy Cross. What does it say? The appointment slots released on Tuesday are now full. So I don't know what days they release them, but if you check it out, some days it'll be like, we are going to release, so many slots, or we're going to release some slots on Thursday at 4 o'clock. And then, people will just wait by their computer, and at 4 o'clock they will go down to here and say, I want to get the vaccine, and it'll already be closed. Like, if you're not super savvy, you're not going to get it as quick as possible. So these open up and close super fast. And a lot of them is they need to be using Microsoft Edge or Chrome in order for it to work right. Any questions? I know it seems confusing, but if you just play around on the websites a little bit, you'll learn all kinds of stuff.
You
mean,
said
this is-
soft something or
Yeah, well, most of these browsers, and especially when they get to the point where they need to register online for their appointment, it won't work in Internet Explorer. So they have to be having Chrome or Edge or something other than Internet Explorer. And if they can't do it, if that's all they have is Internet Explorer, then when it comes time to register, then, send it to us, because then we'll register for them.
So what we're going to do is all the links to this website as well as the spreadsheet will be available. And as Jasmine had noted in the chat, information is changing very rapidly. We will continue to update you on changes as they come along, so that when you go and call people back, you're able to give them the most accurate information to date. So we are now on January 27th. All the information you have is true to as of January 27th. And that's what you need to tell people, that information does change rapidly, and that it is important for everyone to keep updated with reliable sources. One of the phenomena we've seen since COVID began is because people are very anxious, they might turn to social media or friends for links and information. And very often that leads to significant misinformation or spam or fraud. When you call people back, in addition to providing them information about the pre-registration, where to find links on the maryland.gov for other clinics, stress the importance of not relying on any other information sources. We're trying to be very mindful about how people get information so that they don't make mistakes or cause harm to themselves. So make that as a point as you call people back to talk about misinformation and where to find the best where are the best places for information. So Loretta is asking about where people can have registration if they don't have access to a phone. And that goes back to the capacity building we're trying to engage in right now, in finding volunteers and nonprofits in the aging network providers and outside to be that source of support when people do not have access to the internet. So that is happening, and pretty quickly. So we will continue to provide information about where to turn people for this kind of information. Because we know that this is a huge equity issue, and we're investing in capacities for that.
Right. And I'll double check. When you are right about, it does say if you work or live in Montgomery County. So my guess is they're going to honor it if you work in Montgomery County, but we want to try to get them to do it in their own county. But I'll double check on all that information.
Yeah, and I just want to also respond to Loretta's question. One of the reasons we're joining is we're going to be the staff that helps with pre-registration to individuals who do not have the link or have no access to the internet. So this very team is responding to that level of need. We had intended for this team to also actually help with the registration with PrepMod. And I hope at some point we will be able to do that once Deb and her team figures that level of logistics out. Right, Deb, am I representing this? So we are part of the solution for equity and access,
right.
Loretta.
Can I just add, Pazit, thank you. What I was saying is I have no problem with registering folks. I wouldn't get the alert that they would get. So if I put it in the system and they don't have a computer, I'm afraid I don't know if they'll be able to see when, whatever alert or information they'll get, or will I have access to it if I register someone?
No, you won't have access. You'll just, when you're registering, I think at the end it says you were successful, or you haven't, there's say you were doing the pre-registration, you saw that screen at the end, it said, you know, you were successful, you have registered. So then you just say, okay, the registration went through, and you know, you'll get an email. And if they don't have an email, that's fine. They're going to get a phone call from us.
Okay.
Because all of that goes into a huge database, and then we sort it. And so all the people without an email that it's their turn to get the vaccine, we get a list, and then we call them and say, okay, it's your turn. You know, here's the sites. Which one would you like? And then we start walking them through, you know, we start doing that process for them.
Okay, that's good. Thanks.
Yeah, Dorakeen has a question.
Good afternoon, everyone. More so a comment. So I wanted to follow up on Pazit's comment about helping folks pre-register. So we're hoping to expand the capacity of folks who can assist with the pre-registration process. So we're in conversation now to recruit some additional support across the county for this effort. So just wanted to put that in as something that we may be able to provide, because we do anticipate that a lot of folks who may not have access to internet will need some assistance. Even if they have access, we'll need some assistance in pre-registering. So we're hoping to grow the team so that we can expand the pre-registration capacity across multiple sites.
Thanks, Dorkeen. And I think maybe you and I can connect about adding people to one big work group so everything is centralized, but we can talk about that offline.
Absolutely.
So I'm done. Oh, also, I don't even know if I can share it. Hold on. Can you see this sheet that says Montgomery County vaccine page?
No, you might need to switch your shared screen choices. Okay. You can unshare and then choose again. Yeah.
Well, why can't I see it? Oh, there it is, this one. Nope, that's not the one I was looking for. Hold on, hold on. Anyway, I don't know if I'm going to get it up. I don't know where it is. It's not that one, but I can do this one.
Yeah, we're seeing your
yeah, my U drive. Can you see this?
U drive, yes.
Okay. So this says Montgomery County vaccine. So I was trying to do this for you guys. This is the link to the Montgomery County. This is the link to the Maryland, but it's just easier to get to Maryland from Montgomery County. These are the mailboxes. So these are the ones that I guess you guys will be checking and doing the callbacks. So these are just instructions.
Hold on a second. I'm going to stop recording because that's not as relevant.
Okay.
Okay.